are 3 common reasons why people stop using minoxidil. However, had they known this information, maybe they would have continued. My name is Dr. Mohammed. I practice in London, been practicing for over 12 years. And the first reason, well, maybe this reason wasn't your fault. So in order for minoxidil to work, there's an enzyme on our scalp called sulfotransferase. What it does, it converts minoxidil into minoxidil sulfate. That's the active form. For you nerds out there, it's a potassium channel activator, so it causes widening of the blood vessels, allowing more nutrients and blood and oxygen to your hair to support its growth. Now, we have found a way around this by combining minoxidil with tretinoin, which helps to upregulate the activity of this enzyme sulfotransferase, or simply by prescribing the tablet of minoxidil. The second reason is when you start using minoxidil, you start losing more hair and you're like, what the hell? Minoxidil is meant to grow my hair, but I'm losing hair. What the hell is going on? I'm going to go deep for this one, so stay with me. At any given time on your scalp, there's loads of hairs which are in the telogen phase. They're in the resting phase. They're doing nothing for your hair growth. They're just there, they're chilling. Think of them like, I don't know, tenants who aren't paying rent, yeah? So they're just there. Now think of minoxidil as the bailiff. Minoxidil comes along and it kicks these hairs out. And what it does, it increases the anagen or the growth phase of the hair cycle. So when you're losing hair at the start, think of it like getting rid of bad tenants. You should start to notice hair growth by the 2-month mark, but ideally you should wait for 6 months. And lastly, you relied on minoxidil alone. Now hair loss is almost always multifactorial. There's lots of reasons that could be contributing to your hair loss. So think about other things such as low-level laser hair therapy, microneedling, PRP, PRF, checking your blood tests, your vitamin D, your B12 levels, your folate levels, your iron storage, your thyroid function. It's important to make sure that these are all in check because growing hair is very metabolically challenging for the body. It uses a lot of energy. So having any deficiencies here and there will obviously hamper that process. And lastly, don't take any advice from any random on TikTok. Make sure you go and see your doctor for a diagnosis because hair loss isn't a diagnosis. And although minoxidil is a great treatment, it might not be the right treatment for you.